Important, guys, for you to know that as a woman who is creating life in her own womb, there is a part of your identity that is being uncovered. It is a transition that is completely changing our consciousness, our awareness, and especially the way we feel, because the love that you feel when you have a baby in your womb and in your arms changes your whole perception of life. I did think that I would not change so much after I became a mother. I have two babies. I did change a lot, especially my perception and my vision on how life is so sacred. I like to say to all my pregnant ladies who work with me that when a woman gives birth, she becomes a bridge between the universe and earth. This is why breathing and really being completely in sync with the contraction, the natural body contraction, is very important when you give birth. And this is why you want to practice, you want to stay in the same position for too long. So that is very, very interesting. Most women really likes to move when contraction are going. It also help the mind to focus on something else, right? We're not just focusing on the pressure and the contraction. We're also like doing different position. So again, that's helped the brain shift into more focus for baby and excitement. So you can ask your partner to help you sit in the shower, bathtub, and pour warm water on your lower back, especially if you have lower back pain during contraction. This will be amazing. This is something really good to do when you're still at home. You can also do it in the hospital room. If you haven't had any epidural, if you're not attached to anything, you can absolutely use the shower in your hospital. I will have a birth plan template attached to the course here on the library. And I will also have a PDF that explains you more in details how you can advocate for yourself. But basically, your birth plan is very important to do before you get to the hospital, because you have a clear vision of what you want, and the birth plan is going to already give you some ideas of what to expect there and where you want to say no, where you want to say yes. So you make sure that when you get to the hospital, your support team, the nurse are very helpful with the birth plan. Very important that you share it with the nurse and you share it with your midwife or your BGYN. You can even women are not aware of. So usually after 10 to 30 minutes that you give birth to your baby, your body is gonna contract again. Your uterus is gonna do contraction again, the same sensation of the contraction that you just had 4 hours. It's coming back. It's not a nice surprise, but if you're prepared, it's gonna be okay. And then basically your uterus is expulsing the placenta. That's what it does. It's not a long process. Usually the placenta comes out within 10 minutes, if not less. And usually midwives or the OBGYN will help you to pull it out. You do not need to proceed the clamping of the umbilical cord to facilitate placenta expulsion. That is very true. In many traditions, we don't even cut. Postpartum overview. So every discomfort you have is worth telling. Seek support at any time. You can call your medical provider. You can call some independent lactation consultant. You can always contact a postpartum doula when you're in postpartum. Even though you never had a doula during birth or during pregnancy, you can always ask a postpartum doula to come and check on you. Once a mother comes home after giving birth in the hospital, the transition often feels brutal. The whole womb needs to heal from hundreds of mini wounds due to the placenta detachment, potential episiotomy, or C-section. When the placenta comes out, it literally detaches itself from the uterus walls. And this detachment is going to create very tiny, mini openings of your skin tissue there. So it's important to understand that it's gonna have some time to heal. This is why you're bleeding for, 4 to 6 weeks usually. Really give yourself time.